The Urgent Community Response is a collaboration of services that have come together to help reduce and prevent avoidable hospital admissions by providing an urgent crisis response within 2 hours or a reablement response within 48 hours. The aim of the service is to deliver care closer to home, which research shows is a patient's first choice and can contribute to achieving better health outcomes. The crisis response focuses on supporting patients quickly that may have fallen, are worried that they may have a new infection, are struggling with a flare-up of a long-term condition, or whose health has generally deteriorated. The response ensures a full assessment of the patient's needs. The reablement response is focused on promoting and maximising independence to allow people to remain in their own home as long as possible. The UCR team provides a 2-hour response to those who need urgent care and aim to avoid hospitalisations wherever possible. Our multi-skilled team of nurse consultants, advanced and clinical practitioners, nurses, paramedics, therapists and healthcare support workers aim to support patients to access primary care services when they need them. In June 2022, at 11:33, the UCR team received a referral for Peter, a patient that had fallen at home. Within 2 minutes of the referral, Peter had already been through triage and was now waiting for the UCR team to arrive at his home address. Within 1 hour, Peter had been visited at home by a UCR clinician who was able to assess Peter for injuries and assist him from the floor to conduct a full medical assessment. During Peter's assessment, the UCR clinician recognised that although no injuries were sustained from the fall, Peter had a chest infection and was suffering from constipation, which was causing Peter to feel slightly confused. As a result, the UCR clinician was able to prescribe a course of antibiotics and a glycerol suppository to encourage a bowel motion. After UCR's intervention, Peter was able to be fully treated at home. Peter and his family were provided with safety net advice, and he was monitored medically by the service for the next few days with significant improvement. Peter was referred to reablement therapy for ongoing strength and balance training, and a short-term package of care was started to support Peter with his activities of daily living, until he returned to baseline and felt able to manage independently. If Peter had experienced an extended period of time on the floor waiting for alternative help, he could have been at risk of becoming seriously unwell and therefore needing hospital admission.
So for me, it is seeing that kind of instant change. We can get a referral for a patient that can potentially be in a medical and care crisis, and it is then being able to attend that property and within a couple of hours have been able to resolve that crisis hopefully and kept that patient at home safe and within their familiar environment. That gives me a really good feeling when I leave.
What motivates me at work is absolutely 100% the patients. It makes such a difference to them, the things that we do, that we can get out to them quickly, that we can put things in place, that we have all the connections within our team to be able to provide that complete wraparound care for them. That's 100% my motivation.
So I feel an MDT approach is really important as it promotes that real kind of high quality care. We are sharing our learning, our skills between the different members of our service in order to promote that better patient journey.
My background is emergency care, and I think it's about seeing what comes into hospital and what could be potentially managed within the community. So it's about bringing those opportunities into the community and providing that acute care closer to home.
I feel that the main difference that the UCR team can make to a patient is to provide a very timely response. So we will contact the patient and triage their needs. Then we will provide, within the majority of times, a 2-hour crisis response time to get out and see the patient face to face whether that is a clinical practitioner to assess their medical needs, or a therapist to look at things like mobility and equipment needs, or whether it's somebody to go in and look at their care support needs and put that care in place in order to keep them safely at home.
I think there's also a bigger or wider impact to our service partners. So it's about reducing or supporting ambulance response times, and it's about preventing those avoidable admissions to A&E. It gives them that option to be in an environment of familiarity. It gives them that normal routine, so patients potentially with cognitive issues, they're not moved around into different environments which can exacerbate confusion. I think it's about having that informal support from their family, and actually research shows that patients prefer to be at home. Hospital should be the last resort, and I think we offer that as the Urgent Community Response.
My main hope for UCR in the years to come is that it really will become a household name within Coventry and Warwickshire. So for anyone with a Coventry GP, I would like UCR to be top of their list of where they would go for help in a crisis, alongside, with the fantastic services like 999 and 111. I would hope that UCR would be there in their minds to be contacted.
On average, it costs the ambulance service £292 to see and treat a patient. An additional £160 for a patient to be seen and treated in an emergency department, and £303 is the average cost for one night on a hospital ward. The UCR service saves the NHS approximately 25% compared to an ambulance call-out, with 92% of patients referred to UCR being reviewed within 2 hours. There is also a recognised benefit that treating patients out of hospital and in their usual place of residence can reduce ongoing or further dependence on local health and social care services. During a patient's assessment, UCR can offer a wide range of support delivered from a multi-skilled team, from an initial medical assessment, ongoing medical monitoring, holistic support such as therapy intervention, support from district nurses, short-term care support, and equipment and access to care navigation for social prescribing needs. The focus is on empowering patients to remain independent in their own homes and take ownership of their own health and well-being.